Being here on Her Saturdays is such a dream come true to women in need. We can make friends, we can make plans to go out, we can meet new people.
It's just everything you need all in one Saturday. And it's kind of, I never really thought about it. It's like a pop-up shop. It's beautiful.
Her Saturday at its core is a safe space for women. The women that we serve suffer from a lot of trauma, oftentimes complex trauma, come into homelessness, having experienced trauma. Homelessness itself is traumatizing. We can't run Her Saturday without volunteers. Emerging leaders, as everybody knows, are super committed. They come into Her Saturday and they just take charge. So we give them something to do, and next thing we know, they're off and running.
This is my first time volunteering at Her Saturday. So our group is volunteering in the clothing area. So patients can kind of walk around, have a little bit of a shopping experience. It's a nice way to kind of speak to them, understand maybe what they're like, what they're looking for to make their day a little bit easier, and ultimately give them something to kind of go out more confidently into the world wearing.
The social determinants of health and the health-related social needs that patients have beyond just their clinical diagnosis or their condition are impossible to ignore in identifying and designing programs to engage patients in care and ultimately, ideally, get them to a place where they can engage with services to seek housing, to seek stable food sources, to manage their medical conditions.
We flip the typical medical model where folks come in for activities in community and safe space, and then we pull clinical services off of that.
And it's all connecting the patients with outside resources or our resources to make sure they're still connected with care, with primary care. That's one of our top things that we always try to make sure is that we keep them connected.
And some of the more popular activities are clothing giveaways and makeup and nail painting. There's music playing. It feels unlike any other place that the women are allowed to experience during the week.
It's a space that they're away from all the drama outside, the drama from the shelters. It's just a peaceful time for them.
Equitable healthcare for everyone is a basic human right. Bringing the attention to the mission of BHCHP is something that I think the Emerging Leaders Board does a great job with.
It's a circumstance. A lot of people will say, oh no, this could never be me. That's not in my future, and that's just not really the case. You never know when it could not just affect you, but someone close to you and how intensely it can impact them. We want to get things done. We want to spread awareness. We want to help this organization in whichever way, in whatever capacity that we can.
Being part of the ELB, it makes me feel motivated to do more. It makes me feel like I want to get more friends involved.
It makes me feel like not naive. Sometimes you just have to go out in the community and talk to certain people to really understand what their life is like, understand why certain things happen in people's lives, understand why your life is different.
We want people to join who are passionate about the cause of homelessness and healthcare, providing their service in terms of community volunteerism with patients at BHCHP.
I think anyone that lives in the city and anyone that can look around and wants to keep this city as vibrant as it is, it's a great organization to get involved with. And whether it's being on the ELB or whether it's just being a sponsor and someone that's helping out with different activities, there's a lot of ways to get involved. And I think that I couldn't be happier I did.
The emerging leaders are really professionals, young professionals who are on the top of their game, and it shows in the way they interact with our patients.
I feel catered to.
I've been coming since the first day I found out about it, and I will keep coming. In fact, I tell all my friends, I was like, sorry, can't help you, my Saturdays are booked.
I mean, BHCHP, one thing that I've learned in my day-to-day is y'all are like really persistent. And I think there's something to be said for that. Like if someone doesn't reach out for help, even the 30th time, you still go back for like the 31st time, which is remarkable. I think a lot of people will be like, forget it, I give up, this is crazy. But it's something I've learned, like this is actually how public health works. You just have to be persistent and still have faith that someone can kind of change the trajectory of their life.